Joining me now on the show is UNFPA India representative Argentina Matavel Piccin is joining us live. Thank you so much. There are reports suggesting that this virus might not only impact just a particular age group, it could have just about every age group is vulnerable technically. What conclusions has UNFPA drawn as far as India is concerned?
Well, thank you for having UNFPA, and as you know, we're all guided by the experts coordinated by WHO globally, and so our conclusions are still evolving based on the studies that are being and observations that are being made, because this is a new disease that nobody has a conclusive knowledge of. But what we observe is that the elderly, people with immune system that is weaker get impacted more. And for UNFPA, what we're watching out for is for pregnant women and lactating mothers, because that is the major population group we work for.
Among the lactating mothers and pregnant women that you're talking about, give me a sense of how it is going to be playing out in the context of India.
Well, in India, just as elsewhere, there is still no evidence that this pandemic or this disease will affect pregnant women more than other population groups. However, because of the changes that occur in her physical body that sometimes cause a weakening of the immune system, pregnant women may be more prone to catching any other infection, including the coronavirus. And that is why we're working closely with the Ministry of Health under the leadership of WHO to make sure that there is specific guidance given both at the community level to pregnant women and those who care for them, but also to the facility health workers to make sure that when a pregnant woman comes, she gets the right information in terms of, in addition to the general information that is given to all, like washing hands, coughing through a tissue or your elbow and all these things, that the pregnant woman understands that because of her condition, she may be a little more prone because her immune system may be weaker than other people because she's carrying an extra human being in her. And the other thing is also to prepare health workers because, as you know, they are at the front line, and so they come in contact daily with people who are ill, and therefore when a pandemic like this is declared, that means that more people will come to the health facilities and the health workers are more at risk, and therefore they need to be themselves protected with the proper gear to be able to deal with others, but also they need to be able to identify risk cases and refer them properly for testing if need be. A pregnant woman who comes with a cough or flu symptoms or the same symptoms that we're talking about, that means that she's a bit more at risk. They need to quickly know how to refer her for testing.
Argentina, you specifically talked about the healthcare workers who are on the front line. They are certainly most susceptible to this virus at this stage. What kind of efforts are being made by the health agencies to prepare them and prepare them of about a virus, about the nature of which is very little is known?
This has deserved a lot of thought, the protection of care workers in the crisis management meeting that are happening regularly at the Ministry of Health and also at the level of the UN, but also just UNFPA globally and regionally. We are concerned with this, and so what we're trying to do is to set up a system where the health workers have all the protective gear. The government already distributed enough masks and gloves for the health workers, but we are also looking at another dimension, and that is a dimension of mental health, because you see, as the cases will increase, health workers may be called to work longer hours, and they may see an inordinate amount of suffering, including loss of life. And because of that, they may need psychosocial support to be able to themselves manage the stress levels that will be heightened, and to be able to continue to be sane, to provide support to others. So we're talking about both physical protection and mental protection.
Yes, then that aspect of mental health, we have seen how particularly in Italy, people were singing out to each other through their balconies, from their rooftops of their homes amidst this prevalent lockdown and social distancing. What's the assessment of the health bodies such as yours, of the methods that are emerging amidst the lockdown, as this will have an impact on the mental health as well?
Right. While some people are stronger than others in terms of dealing with stress and very innovative and creative in finding out coping mechanisms, there is a place for public health messages of helping people how to cope with stress. That is a professional discipline. So there are professionals out there that are already working on messaging to help people cope with stress, either through even indoor physical exercise, movie watching, playing games with kids or within the family. There has to be a way of supporting the public to deal with this, because as we continually, gradually lock down in terms of trying to contain the pandemic, some people, especially those who live alone or the elderly, may need a bit more help and counseling. So we should have even helplines. UNFPA, for example, is going to work in Madhya Pradesh, for instance, at the state level, at setting up a helpline for people to call in with any questions and to get counseling and help. And so I think at the national level, something like that would help.
Okay, Argentina Piccin of UNFPA, thank you so much for joining us and sharing your views on what can be done, particularly with regards to the healthcare workers who are on the front line trying to tackle the spread of this virus. We are slipping into a short break. Coming up would be our ground reports from several cities across the country.